Welcome back to America Decides. Thanks for staying with us. Health and Human Services Secretary nominee Robert F. Kennedy Jr. is set to appear before senators on Capitol Hill exactly 1 week from today. This, I don't need to tell you, is a highly anticipated confirmation and hearing, in part because the former presidential candidate's well-documented history of spreading false and misleading claims about vaccines. Julie Rovner joins me now. She is chief Washington correspondent for KFF Health News. She also hosts its weekly healthcare policy news podcast, cleverly titled, What the Health? Julie, it's always great to see you. So we have a hearing date now, which we didn't until just a couple of hours ago. Where would you say, and explain to our audience, the status of RFK Jr.'s nomination stands?
I would still say it's troubled, and it's mostly because he has opposition coming from various different directions. There are still
not just Democratic.
No, not just Democratic. There are members of the anti-abortion movement that are very unhappy because until he pretty much took this position as the candidate, he'd been pro-abortion rights. So for most of his life, most of his career. So there are still anti-abortion groups that are extremely worried about him. There are, as you mentioned, public health groups that don't like his position on vaccines and some other some of the other issues. We don't know many of his positions on a lot of the things that the Department of Health and Human Services oversees, like Medicare and Medicaid and the Affordable Care Act, big things with big dollar signs attached to them.
Now, as I understand it, as RFK Jr. has, as every cabinet nominee secretary does, makes the rounds, has been doing quite a substantial reversal on his previously repetitive skepticism, if not outright hostility to vaccines.
Yes, he has tried to describe himself as someone who just wants to see more information about vaccines. Of course, there's voluminous information. They've been studied over many years, most vaccines, particularly childhood vaccines, over decades. And they are known to be extremely safe, extremely effective. Yes, there are people who have side effects from vaccines. That's why there are programs to help people who have side effects from the vaccines. But overall, it is considered an enormous boon to public health. It's really a very small minority led by Robert F. Kennedy Jr., who still, has concerns about vaccine safety, childhood vaccine safety.
And Julie, one other thing on RFK Jr. As I've traveled the Hill, I've talked to senators of both parties who are enthusiastic about some of the skepticism that Robert F. Kennedy Jr. has expressed about oils, processed sugars, and the way the U.S. Agriculture Department would not be in his purview, deals with food and related issues that are subsidized either by the government or are part of food programs for those less fortunate in our country.
Yeah, there are a lot of Democrats who support a lot of what he's been saying about ultra-processed food and, again, about, certain additives that go into foods. The Biden administration, on its way out the door, issued a ban on red dye number 3, which is something that RFK Jr. has been talking about for quite a long time, so sort of getting ahead of it. So you have this sort of interesting mix of people who support a lot of what he does, oppose a lot of what he does, and they're coming from all sides. So it really is a big question mark what's going to happen with this nomination.
Julie, I also want to ask you about something that is reported to be a new move from the incoming Trump administration to limit or halt communication to the public from public health entities within the federal government. Can you describe what you have learned?
Yeah, this is not that unusual that when a new administration comes in, even one of the same party, but certainly one of a different party, that they just say to all the public affairs offices, stop, don't put out any press releases, any changes in guidance, certainly not any regulations. But this seems to go further than most administrations have done. They're going to do things like stop the Morbidity and Mortality Weekly Report, which is a scientific publication that the CDC puts out every week. Apparently, it's only going to go through the end of the month, but this does seem to be a bit more dramatic than the usual, just wait until we have our people in place so we can coordinate things.
And it does create an atmosphere that perhaps the information that you might have otherwise been delivered is not necessarily as trustworthy, and they want to have their own brand on the information communicated from the federal health officials. Julie Rovner, always great to see you. Thanks so much. I hope you'll come back.
Sure.